Hi, I'm Jyllenna, and this is my COVID-19 story. My husband works in a long-term care facility, and while neither of us have been diagnosed with COVID, and no one close to us has been diagnosed with COVID, the weight of the potential implications of getting COVID have weighed on me, knowing that if I got it, I could pass it on to him, and then he could pass it on to his residents, and then there could potentially be deaths, has really been difficult for me to grapple with, especially during the early stages of COVID. I was so nervous going out, even going grocery shopping. I was so nervous that I was going to contract it and then pass it on to him. And that also resulted in significantly reducing any kind of social bubble. Even when it was safer, we still kept it fairly small. And then when his facility did eventually get a COVID-19 outbreak that affected a lot of staff and residents, it was really isolating because before I had been working twice a week and had been seeing one or two people in our bubble, and that got taken away right away because none of my friends were comfortable with seeing me in person, and then my work wasn't comfortable with me going in either. And I wasn't seeing my husband as much because he was working really long hours because there was limited staff there, so I found that I was alone for most of the day and living with this really increased threat of getting COVID just because of the reality that he was working on the COVID-19 outbreak unit every day, so there was a significantly increased risk. That was really difficult to cope with, and I initially got through it just by working probably too long of hours, not really taking care of myself as well. So I ended up making some adjustments, including I started talking with a counselor online, and I also really tried to establish an end time for work. So I would set usually 5 or 6 p.m. work would go away, and I would try to do some kind of positive self-care, like cooking or baking or something like that. So kind of trying to force myself into some kind of a routine was helpful. I've also tried to limit how much information about COVID-19 I am consuming. Especially during the early stages of COVID, I was reading everything I possibly could. I was reading Facebook and Twitter and Instagram and news sites, and I found that really, really overwhelming. And so I've tried to limit it to only things that are relevant to me. So I check up on the number of cases in Ottawa per day, and then I also look at Carleton's, anything that they send out, and then Ottawa Public Health as well. I find them really useful. They're really funny, and they really convey the information really well. I find that if I read too much, it will just overwhelm me, and I will leave with just a bigger sense of dread. If I had one final thing to say, it's to check in on any healthcare workers you know and their family. They're working really hard right now, and it can be really, really isolating. So just checking in and seeing how they're doing, seeing if there's anything you can offer them in terms of assistance, and showing your gratitude, I think that would mean the world.